Hey guys, welcome to the Heart of David. I have a good video today. I think this will be very informative for people. You may think it doesn't have to do with God, but it does. If you know someone who has Alzheimer's, which is the most common form of dementia, and there are so many different kinds of dementia: vascular dementia, FTD, frontotemporal dementia, frontotemporal dementia. In any case, I wrote an article. I enjoy writing articles, and I'm volunteering at a nursing home. And just pardon me guys, I gotta get some water. Just a second. This is very interesting. Listen to my article, and I'm gonna show you something like that'll blow your mind at the end, plus my own story, and you'll understand. This is geared towards people who are either taking care of a loved one, someone you know, or you're like I don't know, you could be just a nurse, or you could be a physician. Watch this, and especially watch the videos at the end. I'm not incorrect about this at all. Just give me a sec. I have problems with my throat, so I used to make videos about antipsychotics and their dangers. You wouldn't know it, but some of the most prescribed medications on planet Earth are antipsychotics, and there are many books written about them, about their brain disabling effects. Okay, and so here's the backdrop. I'm studying to be an addictions counselor. I'm a certified recovery coach now, so I'm studying in university, and I'm getting experience. Like, I'm looking for experience, just to, like, one-on-one, to be one-on-one with people. I've always enjoyed helping people, so just to volunteer and get the experience in. And so I have been, and I've been in a nursing home. So it's a retirement home and a nursing home are quite different. A nursing home is where it's your end to end of your life, right? And to be honest, I didn't expect for the nursing home to be about 85% dementia patients. And so, I made another video just before this, and I had to stop because I screwed up. But I said that Alzheimer's is the most known cause of dementia. And so there are many types of dementia. Frontotemporal dementia, which accounts for a very small amount, like maybe 0.5 or 1% of them. And I have a personal story about that too, about somebody I know. But anyways, I'll read my article. I think you'll enjoy it, but the video's at the very end. You wish you didn't miss it. Don't miss it. Don't miss these videos that I'm going to show you, okay? When any physician is shown these videos and these results, their eyes are open. Okay, so before I read my article, I just want to say this. I have difficulty speaking, guys. But I just want to make sure I took my pain med, because I can't remember if I did. Yeah, so it helps my throat. I didn't expect some of the things that I've seen. My throat's bad, man. It's so cold here. It's like minus 18 Celsius, so maybe it's all the dryness. I don't know. It's pretty cold right now. I didn't expect to see a lot of the things that I have been working with. And in particular, I've been working with one woman who I see so much fear in her eyes. And whatever I say to her, she understands. But she can't express herself. And, you know, she's picking at her clothes, and she's, you know, in somewhat of an advanced state that can still understand. You know, you have to be very soft with them, very calm, you know, gain their trust and all that type of stuff, and I have. And I wondered, and I'm going to attempt to speak to the physician on duty to see if she can get what I'm going to show you in this video, which would be a capsule of CBD, cannabinoid. And, you know, normally I don't ever want people using marijuana, okay, because I know what that does psychologically to people. But if you see these states, when you're in that state, it's about quality of care. It's unbelievable, the miracle of giving a capsule of CBD, what will do to a demented patient that you think are far gone. And it's not just me looking on a video and saying, hey, look, I see this, of which I can see many of them, but a personal story of my friend. I do believe in most cases, it will calm a person down because it takes down their level of agitation. So whether you give them CBD mixed with a small amount of THC, whatever it is, go look up the ratios, you'll find out. It works. It works. And the worst people who you think could never return, watch the videos at the end. I record videos either at night when I'm sitting down, that's when I do my edited videos, or standing up here. This is on my Windows. This is Windows recording this. So if I try to put a video and edit it, you know, and talk while you see the video that I'm talking about, I can't put this video on there. Just a 5-minute clip on a Windows recording, it takes like an hour to do, even on the fastest 5G speed. So, but I want to do this now. Just watch a video at the end. I'm going to read you my article. And so if you have a loved one that is, you know, everyone knows someone who has some form of dementia, Alzheimer's, whatever it is. Remember Robin Williams? That was Lewy body dementia. So I'm just going to take a little sip of water and a little bite of my food, and then I'm going to read this. So I wrote this yesterday because I felt really, you know, I just had to write it. And sometimes my best words are when I get on paper. Just give me a sec. My voice is bad today, man. It's heartbreaking. I'm telling you. You know, like when I'm with this person and they're looking into my eyes, and you're looking right into their soul, man. And they're just with their walker walking through the hallways aimlessly, picking at their clothes, you know, like a cancer patient would do at the end of life care. I saw my mom doing that. So, should dementia patients be given antipsychotics? CBD is a miracle. Let's just call it cannabinoids. It's just an overall umbrella for them all. Should antipsychotics be given to dementia patients? This is a non-biased opinion of the usage of antipsychotic medication in fearful, agitated, combative, and confused dementia patients. I have no formal medical training, but I'm in university. I've studied this stuff for quite some time. I don't mean in depth of medical terminology and the science and everything like that, although I am in applied science right now. No, I don't have dementia, but I don't have dementia, but I was given haloperidol, Abilify, Risperdal with horrific, so I was given them with horrific acute akathisia, acute dystonia, and I guess it would be acute opisthotonus, which means the opisthotonus means extreme contractions of the spine and back, much like the dystonia would do, and you can't reach around to relieve it. There's no worse feeling on planet Earth than acute akathisia. Like being buried alive, restlessness so severe that you cannot sit or eat, and when you get up, you want to sit down, and when you sit down, you want to get up. When you go to eat, you'll try to eat, and then you'll just be like, I'm too restless. I've been there. Restlessness so severe that you cannot sit nor eat in its true acute phase, which usually lasts, as a rule, but it's not really, for 72 hours, in probably most cases. Acute means a short period of time, which is usually 72 hours, but can persist for weeks in some cases, and permanently. I have a very hypersensitive nervous system all my life for many things. I have autism. I know someone who has it permanently and lives in constant dysphoria. So I spoke with someone who has it permanently. Suicide is the most common symptom of permanent akathisia and acute when you have it. You just want to die. I'm not kidding you. This is something you've probably never heard of and something you never want to know about, let alone feel it. My own experiences matter to my overall paper. Alcohol was a culprit for my aggressive behavior as a teen due to anger from traumatic events. No less than 8 times I had acute akathisia due to haloperidol, and they were about 72 hours, except for 2 of them. And the longest bout was Abilify, which nearly took my life in surreal distress after multiple dyskinesias and was not believed. I wasn't believed after about the week mark because for the sole reason of crossing the 72-hour boundary, but I was bending over beds and dressers to relieve spasms. That's what opisthotonus is. Haloperidol, and so that was given to me, by the way, Abilify, when I had gone in to ask for help for my pain because it was my intractable pain, which wasn't diagnosed at that time. I had gone, and the only place that would take me anymore, because there was such a lineup for specialists that I wanted to go through psychiatry. I was that desperate. I didn't need to be there. I didn't need to be there, but I was going in there in the hopes of getting a referral. And then I was given Abilify against my knowledge. It was just, when they say, here are your medications, because they control them, they put one of those in there. Even though I had a red warning bracelet that I can't have them. Today, haloperidol gives me nightmares. Today, I suffer with the pain, suicide, diseases, and have been through many full-strength opioid withdrawals. Don't worry, I'm getting to you'll understand why. I have been through many opioid full-strength withdrawals from the beginning to the very end, many times, due to hyperalgesia. The very depths of opioid withdrawal don't hold a candle to what acute akathisia feels like. I know some reading this know exactly what I mean. The first person, or one of the first people to tackle the danger of antipsychotics and benzos, was Peter Bregan, who my father contacted to speak to me while in such an episode when I was younger. Another safer alternative must be considered, but in my own estimation, It's a moneymaker worldwide. Those antipsychotics, like I said, go look at the 2013 top-selling drug. It was Abilify. Can you imagine? It was given for everything: anxiety, depression. Because it's a moneymaker worldwide. I encourage you to research permanent movement disorders, which are not uncommon, but common with antipsychotics. I'm studying to be an addictions counselor in university, and I'm having great difficulty locating a practicum due to my severe pain, but willing, because I can't go out there for 8 hours a day. I'm also a certified recovery coach, and I'm good with people. For experience's sake, I am volunteering every 2 days at a nursing home with 85% dementia patients. A poor woman that trusts me just mere hours ago was in a state of despair and fear, likely also paranoia and delusions. Yeah, it was. She thought her brother was there, but he wasn't. Aimlessness and picking at their clothes. No one else in the home appeared like her countenance. Talk therapy helps a lot. Okay, so that's what I noticed. Like, just sit down, and she's been wandering around for hours and hours, and fear and anxiety and delusions and paranoia and depression. So you sit her down, right? Hey, let's talk. Talk really slow with them like this. Now I fully understand why it's administered. So I'm saying now I fully, not now I understand, but I fully understand why antipsychotics are administered in things like combative states when people are trying to fight and stuff. But they talk about benzodiazepines dangerous comparatively. I think the worst danger is in antipsychotics because they can cause you a permanent movement disorder. Just my opinion is you could give them a Valium and that should suffice. Don't give it to them and then just only give them one per day. You're going to have to keep them on a constant regimen so they don't go into withdrawal. Something like Valium would last for years without any tolerance issues. It's about quality of life because it has a long action. Would a benzo not calm them down as well? And I understand it's a delusions and combativeness, so it would calm them down, but they need something immediate. And I understand what they're looking for and why I make this video. You can find these stories easily if you look for them. The elderly who got much worse after a dose of powerful antipsychotic. Watch the video. Imagine for a second a person in deep psychological distress and torment, only to be given a drug that induces acute akathisia and dystonia, and compounds the issue, much like psychiatric wards, and given even more because they believe it's simply natural agitation. They just keep dosing them and dosing them. Can you imagine in that state? They're in like a delirium and then you give them something that gives them acute akathisia. That's a nightmare. Because they believe it's just simply natural agitation and they don't understand what these medications are doing to them. They're just nurses. They're just nurses. I'm not saying they don't have good training, but maybe they don't know enough about them and what they do. The studies cannot be refuted. They are brain disabling medications, if you can call it that, medications. If given one dose, I will have acute akathisia within minutes. Even further to my overall opinion, I had a friend with Pick's disease, which is also called frontotemporal dementia, and spoke with him nearly every day to help keep him busy. I met him in an akathisia chat room on Facebook. This was years ago. He was embarrassed to reveal to me that he was sick, but he eventually had to. Well, he did, you know. Obviously, if I keep talking to him, he wanted to let me know what it was. He was in the akathisia chat room because he feared that antipsychotics being used against his will. That's what he feared, because he had had a dose, and that's what it did to him. So he had dementia, Pick's disease, and that's what it was doing to him. So I know. Do yourself a favor and search for these very words on YouTube, but just look at the videos I show you. And there are hundreds of videos that will prove how dementia patients can benefit from pill or capsule form of CBD or marijuana. Some people, you know, just THC. And I do truly believe this is a uniform response. Also, depending on what stage it is, you'll see something happen in every stage. A miracle right in front of your eyes. My friend would disappear for days at a time and return with stories of being lost in the neighborhood, along with all the fears that he was facing. He was my litmus test. I don't mean it like that, but he really was, right? To this, when I made the suggestion of cannabinoids, because I started researching stuff for him, and that's when I came across this, he jumped on it, and the difference was night and day. I couldn't believe it. He was, you know, he went from making a lot of spelling mistakes and a lot of trouble. He never wanted to talk to me on the phone because he was too nervous. Man, I don't know. I don't know what's going on with him now. I honestly don't. It was night and day. He was talking with clarity, but it didn't last long for the sole reason that his condition was going so quickly. He was worsening quickly, and you can't stop the progression, but the clarity was beyond words, like a new person. I'm having a lot of trouble with my throat and my abdomen, pardon me guys. Sometimes I can't tell until I start making a video. Marijuana and CBD might actually suppress areas of the brain responsible for inflammation. Why is this? What does it do? And is it a natural antipsychotic? I do believe so. Don't take my word for it. Go type dementia being treated with CBD and marijuana and watch. You know, what I would say is use the least amount of concentration, but if they can tolerate it, you can keep moving up until they respond. This is underestimated. You'll see by the video the response of the doctors. And do you truly think Big Pharma would endorse this? The same Big Pharma that ruled our lives not so long ago, and I live in Canada where the worst of it took place. It reduces the agitation, anxiety, and restlessness and fear associated can assist in memory recall, but only by the mere fact that the agitation has been brought lower. Hence that it was always there, but it just wasn't retrievable. So if you're super agitated, super anxiety, and you're restless, and you're picking at your clothes, how much memory do you think they're going to be able to retrieve? Probably none, because they're so agitated. But if you give them THC, whatever level, or CBD works by itself. You bring that level down and you'll see what comes out. Pardon me a sec. Could be a stone, kidney stone. I've been dealing with them a little worse than usual. I'm going to read that again. It reduces the agitation, anxiety, and restlessness and fear associated, and can assist in memory recall, but only by the, like, it doesn't give them their memory back. That's not what I'm saying. But only by the mere fact that the agitation has been brought lower, hence that it was always there, but it just wasn't retrievable. Also, it naturally relieves tenseness and pain. I'm not a fan of marijuana and psychological deficits in long-term use, but when you lose everything and you're in despair and agitation, quality of life matters over everything else. You weigh the scale with your loved one. I had nurses contacting me due to antipsychotic reactions in some of my older videos. And they were dementia patients. They were getting worse. Because I had made a video about this. But I already knew because I lived it. If anything, the demented elderly would be more susceptible, but that's only a guess. I'm trying to take a non-biased approach here. Please click on the link or copy and paste this. This Down syndrome dementia sufferer. It looks like it literally reverses course, or whatever you decide to call it. CBD and THC capsules, and combined, whatever, you can just get CBD. CBD, I don't think you can get CBD without THC, but you can get CBD with like 0.07 THC, which is very low, and it would work. And THC capsules and faster acting solutions should be incorporated into care. I do believe they should be incorporated into care. The question is, how quickly can it work? So it's not desirable for an emergency situation. So in an emergency situation, they'll give like haloperidol with a mix of, they give it with a mix of Valium or Ativan. Why? Ask yourself that. Why? Why do they have to give Valium or Ativan with a needle of haloperidol? Because of its side effects. Ask the honest question, how would Big Pharma support this? How often do you witness this reaction from antipsychotics? You don't. It would be very few and far between. Or how about this video on the news? So watch these two videos. So one of them is the newscast about medical CBD marijuana and how the antipsychotics destroyed their loved one. The answer lays in our face, and physicians know the answer when they see it in front of them. In short, this is a no-brainer. Watch both, please. I would say to begin with the low-dose CBD. This is just, this is common sense. Start with the lowest type of thing, possibly with very low THC. Never use 100% THC. Just because THC can go up to 100%. I told my friend, his name was Johnny, and with dementia, FTD, he thought that the higher the THC, the better he would get. I looked it up quickly because I knew that probably wasn't right. And I warned him about it, that it would make him sick, but he bought it anyways. He ordered it, and it came, and then I didn't see him for about 3 days, and then he came back and he said, "You're right, I got a big fever." I think he had to go to the hospital, and he was really sick. So it worsened his condition. That's 100% THC though. So I'm going to leave you the links to these videos. So if you have a loved one that's like this is, what do you have to lose? I believe this should be the mainstay. I believe that marijuana, right? But CBD and a mix of THC, whatever it is, I do believe they are natural antipsychotics is what I'm trying to say. I do believe it will calm them down in ways that will blow your mind. And you'll wonder why this isn't broadcast all over the news. Hence why I say, why would Big Pharma let this just take over when they're making many, many, many billions? I'm talking about, so 2013, the top drug, go look it up if you don't believe me. 2013, the top drug sold in the entire world was Abilify, and it made something like, I don't know, $13 billion. This is a big deal to Big Pharma. This is why we live in the times we do, because of medications such as those. Anyways, guys, this does. Anyways, for me, it has to do with God. It has to do with at least trying to do the right thing and having compassion on people. I have a lot of problem with my voice today. I have dysphonia of my throat, so I don't know. Anyways, God bless.